If you find yourself walking more hunched over, this video is going to help you understand why that is and some interventions we can do to actually help that problem. This is also great if you are noticing a loved one that is starting to walk hunched over and you're starting to wonder how you can help them. I'm Dr. Clara Derry. I'm a physical therapist. I did my orthopedic residency at Mayo Clinic, and I am here to help you be well anyway, no matter what life throws at you and what season you're in right now. So walking hunched over with that increased curve in the back of your spine is also called thoracic kyphosis in the medical world. So we would say that person has increased thoracic kyphosis. And I do see a lot of patients who come into the clinic who are symptomatic with this thoracic kyphosis, and that's the reason that they're there. But also there's a lot of people who are asymptomatic with their thoracic kyphosis. That is not a big limiter for them, at least they don't feel like it is. What I also notice with my patients who come into the clinic for this thoracic kyphosis is more often than not, there's a family member coming in right behind them that is saying they need to fix their thoracic kyphosis. They're always hunched over when they're walking. They're always looking at the ground. I tell her to stand up straight, but she doesn't listen to me, or she can't remember to do it. Or a lot of the family speak seems to be putting the person with the increased thoracic kyphosis at fault, or like there's a deficit of them that they are unable to remember to stand up straight, or they're just refusing to do it. And that could not be further from the truth. So if you are a family member of somebody who you notice is starting to walk around with some more increased thoracic kyphosis, please stick around and let's talk about this together so we can actually work towards helping your loved one. And if you are the person with thoracic kyphosis, this is a great one to share with your loved ones so we can all be on the same page and truly help you to get the results that you are wanting for yourself. So having an increased curvature of that back can lead to some scary things that we don't want, right? It can be an increased risk of falls, impaired mobility, increased fracture risk. Of course, we don't want those things for you. We want all of us to live a long, healthy, high quality life. But I will tell you, our bodies are amazing. And the way that they can compensate truly just blows my mind every single day. So yes, when you have increased thoracic kyphosis, it makes your body work differently. You aren't able to raise your arms as high because raising your arms all the way up works in combination with that thoracic kyphosis, with your thoracic mobility and your scapula on your back to give you full mobility. So if you notice that you are starting to hunch over more and you aren't able to reach up as high, those things are absolutely related. Also, the position of your thoracic spine changes the cervical spine position right above it to compensate for that change of an angle. So you might notice a little bit of increased neck pain or some stiffness in your neck, or you may notice a difference in your field of vision. Either you're looking down more to compensate for that thoracic kyphosis, or potentially you have a little bit worse balance now because your normal alignment that you have had for most of your life is changing and your body is really trying to adapt to it. So if you take anything out of this conversation, I want you to know that your body is resilient and it is adaptable to change. And just because you have one thing like thoracic kyphosis or whatever it might be, you can still be well anyway. We just have to figure out the right plan for you. Something else important to talk about is mortality rate. So mortality rate is higher in this group of people who have this increased thoracic kyphosis. Also, severe hyperkyphosis can be related to an increase in pulmonary death among women. So these things can sound a little bit scary, and I'm not trying to scare you. Again, our body is very resilient, but it's important to realize how your entire system is working together. Your thoracic spine may have an increase in curvature, but it really affects your whole body because your whole body works as a system. So if this increase in hunching over when we're walking is not that patient's fault specifically, if it's more of a processing going on in their body, then what is the cause of that? Well, we don't have one cause specifically. And as I said, I believe it's because our body works as a system. It's not just one biomechanical failure that causes this significant of a change. So what we see is all of your vertebrae in your spine. This is very large, right? They kind of look like a sandwich, like they're like a nice big fat rectangle, right? And in between all of the vertebrae of your spine, you have your discs. They go right on top of each vertebrae to give them a little bit of cushion between those bony vertebral bodies. Well, as we age, we see that those discs start to lose their squishiness a little bit. They start to lose their height. They start to lose their fibrous ability to maintain their shape. And instead of them looking like a mini sandwich, they start to look more like a wedge. That anterior disc height can start to decrease in our thoracic spine, and it creates more of a wedge-shaped disc. Well, you couple that with some bone density loss. So we're either looking at osteopenia or osteoporosis, and we notice that our big sandwich of our vertebrae also starts to look more like a wedge in that anterior compartment. So instead of stacking all of these big sandwiches and little sandwiches on top of each other, now we're stacking these wedges on top of each other. And when you stack those wedges, you can't help but to have an increase in the curve that is caused from those wedges. That's just physics. So we have this degenerative disc disease, or DDD, which is truly just wrinkles on the inside. It sounds like a really big scary word, but like degeneration of our discs or aging of our discs is something that happens over time. Sometimes it's symptomatic, sometimes it's not. It depends on that person's system as a whole. So we can't change that, but something that we can change is our risk for osteopenia and osteoporosis. And hold on to that thought about the osteopenia and osteoporosis, because we're going to circle back to that in just a minute here. The other two causes that we need to talk about for this thoracic kyphosis is muscle weakening and decreased mobility. So we know that the muscles in our back, our spinal extensor muscles, they're in charge of keeping us in extension, or you can also think about it as opposing that forward flexion, that when they are stronger, that person has less of a thoracic kyphosis angle. So what these studies don't tell us, though, is chicken or the egg. Does the increase in thoracic kyphosis happen first, and then the spinal extensors get weaker because they have a harder angle to work at? Or do we have these weakening spinal extensors first that allow for thoracic kyphosis to progress more quickly? We don't know that answer. But what we do know is that there is an inverse relationship between grip strength and ankle strength and kyphosis. So when grip strength and ankle strength are stronger, their values are higher, we have a lower risk of kyphosis. So in my brain, what that's telling me is a stronger system has less thoracic kyphosis. So it makes me lean towards weakening spinal extensors cause or allow for an increase in that thoracic kyphosis. We also know from cadaveric studies that there's a difference in mobility in those patients who have a more significant thoracic kyphosis, especially in their pectoral muscles and in their hip flexor muscles. But again, like our spinal erectors, we don't know which comes first. Do they have a shortened hip flexors and pectoral muscles? And then the thoracic kyphosis is allowed to go because there's less opposition, but we also don't know which one came first. Going back off of that last thought about muscular strength, I would argue to say that the muscles probably get weak, which then gives less opposition for this thoracic kyphosis to progress. And then once we're in that thoracic kyphosis and we have that anterior wedging of our discs and of our vertebrae, it's a lot harder to get out of that state. So the body compensates as best as it can, and we get the short pectoral muscles and the short hip flexors to further facilitate that forward hunched posture. Now let's get to the good stuff. So we have three main ways that we are going to tackle treatment of this. And the best first-line treatment for all of this thoracic kyphosis is physical therapy, because almost all of these impairments are within the musculoskeletal sector. And musculoskeletal care is the specialty of a physical therapist like myself and like a lot of other great providers out there in the world. So when we're looking at strengthening, the biggest thing to focus on is your dosing. We're aiming to prevent sarcopenia. We're aiming to prevent osteopenia and osteoporosis, which both of those things are basically like muscle wasting, losing muscle, and losing bone. So the goal of this exercise is not to make you look good in the summer. Maybe it'll help with that too, but it's really to protect your muscles and to protect your bones so you can age well and you can live a long, healthy, high quality life, right? We're all chasing that longevity, and this will help you to get there. So when we're looking at the dosing for our exercises, we want to keep our reps between 6 and 8 repetitions before your body feels like it needs a break. If you're just starting out, that may be with no extra weight added. You might feel pretty darn tired after you're doing 8 repetitions of that exercise. However, if you get to 8 repetitions, it doesn't feel too bad. You know you can do a lot more. that's when you know that you need to start adding some weight to keep yourself within that 6 to 8 reps before your body needs a break. Anything more than that, and you can get different exercise benefits, like you can get your heart rate up for a long period of time, you can train muscles for endurance, but that is not the focus when we're training for sarcopenia prevention, osteopenia prevention, and osteoporosis treatment. There are recommended exercises that are out there in the research, which of course are a great place to start. My biggest thing that I would educate you on, though, is as we've learned, this thoracic kyphosis is not a one specific muscle or joint issue. It is a systemic issue, and it is not going to get better if we only try to treat one muscle or one joint. We have to treat the entire system. So if you are truly looking to tackle your thoracic kyphosis, or you're walking with that hunched over posture, then we need to target your entire system. Your entire system needs to be stronger and probably loaded a little bit more. We probably need to work on your mobility, and we probably need to work on your proprioceptive awareness of where your body is in space, but also your body's ability to understand where you are in space, like to balance better. If you think it'd be beneficial for me to walk through a video of these actual exercises that are prescribed in some of the research articles, I would be happy to do that. Let me know in the comments. Otherwise, I want you to go out and get your system stronger. Go see a physical therapist who understands sarcopenia, osteopenia, and osteoporosis, and how to actually load you safely and appropriately within that 6 to 8 repetition range. When it comes to mobility for combating this thoracic kyphosis, there's something called upper cross posture or upper cross syndrome. It's basically just a word we gave to this grouping of things that are tight and things that are weak that we see a lot with this increase in thoracic kyphosis. So when somebody is in this increased thoracic kyphosis, whether it's a fixed thoracic kyphosis, like when we're older and has a hard time moving in and out of that, or whether it's a very young person who's simply a desk worker and sits all day hunched at a desk for prolonged periods of time. What happens with that is the muscles in the front, the pectorals, get tight and stiff, and it's harder for them to open up. And the muscles of your back are constantly stretched out, so they get weak. A muscle that is put on prolonged stretch gets weaker. It's simply harder for it to do its job. Moving up the chain for that upper cross posture, our neck compensates because our body is incredibly smart and resilient, and it works to combat that changing of an angle. So we start to get this forward head posture, and typically we get a little upturn of the head when we're sitting at rest. So the muscles in the back of the neck get shortened. It can lead to a lot of headaches or a lot of tenderness right at the base of that skull where you connect to your cervical spine. And it can get a lengthening and thus a weakening of those muscles, those deep neck flexors at the front of your neck. So part of the treatment of stretching and mobility for this is correcting those deficits. I'll show you a great exercise that I give to my patients that they can do anytime they're seated in a chair that really works on stretching out the pecs, improving the mobility of that thoracic spine, increasing the strength of those deep neck flexors, and stretching out those paraspinals of your cervical spine. All right, so let's talk about these few exercises that you can do while you're seated to help to fight back against progressing thoracic kyphosis. So I have a foam roller here. They make all different types. This one has a bunch of bumpies on it because I like it for my soft tissue massage as well. You can get a smooth one or whatever you please, but the short version of this works a lot better than the longer versions for this exercise. So you want to put it behind you horizontally, and then you start around the bottom of your thoracic spine. So where your back starts to curve upwards is where you would start with this. So you want this to be comfortable. If this is at all uncomfortable for you, then don't do it. And if you have any concerns about doing this exercise for your body, consult with your physician first or consult a physical therapist so they can make sure that this exercise is safe and appropriate for you specifically. Okay, let's jump in here. So you can either bring your hands up to support your neck, or I like to just cross them and hold my shoulders. You're just going to gently arch back over that foam roller and come back up. You should feel your thoracic spine wanting to stretch over that foam roller. I do about 3 in each location. And then you scooch the foam roller up to a higher spot on your thoracic spine. Same thing again, hold your shoulders, arching back over it a few times there. Good. Keep it going up. Arching back again. You might notice once you get up to the top of your thoracic spine that your shoulder blades can start to get in the way. And when that's the case, you're done with that exercise. You go back down to the bottom and you start again. So that's one option for you. Another option is if you place your foam roller vertically on your chair and you scooch it up to the top of that thoracic spine. And then I want you to just press back into it and open your arms up to come behind there. You'll get a nice big pec stretch. And that foam roller brings your back off the chair, so your arms can go a little bit further than they would if they were just resting on the back of the chair. You can actually get that stretch into your pecs. That's opening up the front of that chest. You can hold that there for 30 seconds, all the way up to a minute. Good. And then you come back in and take that out. All right, the next one that I have for you, you're going to put this foam roller behind your lower back so it rests between your lower back and your chair, and it just helps to support you in the upright position. So once you're sitting up nice and tall, I want you to take 2 fingers to your chin, and you're going to tuck your chin in like you're trying to give yourself as many chins as possible. You're going to feel ridiculous. That means you're doing it right. Okay, so you're going to tuck your chin in and hold it there. And I also want you to pretend like there is a string on the back of your head, and it is pulling you straight up to the ceiling. Okay? So straight up to the ceiling there. You should feel the back of your neck, the back of your cervical spine start to elongate out. You might get that stretch in those paraspinals there, and the suboccipitals right at the base of your head. And then relax. So tucking the chin with your fingers makes your neck flexors not work as much, but it can also give you a little bit of a proprioceptive input to help those muscles remember what their job is supposed to be. So they can contract to pull that chin in, and that string pulls up on the back of your head. You can hold that for about 30 seconds. Then you would relax. This is a very simple, gentle exercise, so you can do this throughout your day. You can set that timer to remind you of your posture, but also set your timer to remind you to do these exercises. This would help your mobility, and then you couple that with the strengthening of your entire system to prevent sarcopenia, osteopenia, and osteoporosis, and you're giving yourself the best shot possible to avoid that thoracic kyphosis or avoid it from getting worse. And the very last topic to cancel, which is something I get a ton of questions on in the clinic, is do I need to be wearing a brace to help me sit upright? There's a ton of braces on Amazon that help your shoulders go back, straps across you here, and it holds you up here in this position. So do you need one of those? No, you really don't, because that is a job that your muscles are supposed to be doing for you anyway. However, what that brace does is it provides a tactile input to your system to remind your body of where it needs to be living. I don't love braces though, because what I find clinically is that it can be difficult to get people away from that brace then that they spent the money on to buy. If they just need it for that tactile input and not for a prevention of anything more significant, which would come from a recommendation from your physician, it can be difficult to put them in something that makes them live there without their muscles having to work, and then saying, okay, now it's time to take it away and let your muscles do the job. It's better financially, and it's better for you to just have your muscles start doing that job to begin with. If you really are looking for something to give your body that tactile cueing, you can start with something really simple and inexpensive of just taping. So most physical therapists should be able to provide, most physical therapists should be able to give you a little bit of taping, assuming that your skin is able to tolerate a tape that can give you that same proprioceptive input for your shoulders up and back without having to spend the money on a brace and without you feeling like you need to rely on an external solution for your problems long term. And the very last and the cheapest thing to do and the easiest thing to do is just to set a reminder on your phone, on your watch that says, check in on your posture. Every time it goes off, you give it a little evaluation. Are you all slumped over with your shoulders down? If so, just sit back up and live there for as long as you can until you forget and your reminder goes off again. The hope is with that over time, if your posture is simply due to a lack of realizing that you're in that posture, then you'd be able to hop right out of it. We've covered a lot of ground today. That was a lot to talk about. That was a lot to learn. Whatever questions you have, drop them in the comments. If you'd like for me to do another video that breaks down some of these topics more or does some of these exercises we discussed in these videos, just let me know. I'm more than happy to make those. If you take one thing away from this video, I want it to be that your body is resilient and it is capable. And no matter what life throws at you in this stage, you can be well anyway. We just have to find the right plan for you. Until next time, I'm Dr. Claire Derry, and I'll see you soon.